The biggest take-home message is don't be afraid to try. There's a saying that the master has failed more times than the apprentice has even tried.
I'm sitting here with Dr. Volker at the DentalWorld conference, who is an internationally well-known lecturer of aesthetic dentistry from the United States. Dr. Volker, thank you very much for being our guest today.
It's my pleasure. Thank you so much for having me.
Thank you. Could you please summarize your lectures for the ones who couldn't attend?
Sure, absolutely. So what we basically talked about today was uses of direct composite. But not just how to do it, but also pitfalls and mistakes and ways that you can help avoid any type of problems so that you don't have to repeat mistakes that many of us made before.
And what do you think is the most common mistakes dentists do when they do direct restorations at the anterior region?
Absolutely. That's a great question because I see this all the time. What happens is that we so often will overdo translucency and we underdo opacity. So sometimes we try to make something look good and make it look lifelike, but really what we end up doing is creating a very gray, very unesthetic blob of composite, and you still see the crack that you were trying to fix in the first place. So sometimes it looks like you made the situation worse.
And what do you recommend to use instead of the translucent body?
Sure. So in those kind of cases, we have several options. One is we can use some material called a microhybrid composite, which works very well, especially in larger fracture areas. But, sometimes with very small fractures, what you might want to consider using is a liquid flowable opaquer. And they work very nice, especially if you don't have too large of a fracture, and you can hide your fracture lines quite predictably with them.
Thank you.
No, of course.
And nowadays there are a lot of opinions whether we should do the simple technique or the multi-layering technique. What is your opinion about this topic?
I will say it depends, because that's, a very dangerous question to be asking.
I know.
I would say it depends on several factors. One is your comfort with the materials themselves. If you feel very comfortable and very confident with doing layering, I think that's a very, very nice technique. But sometimes if you don't do it right, you don't get the result you want, and it can, again, sometimes look worse. In those cases, sometimes doing single shade, maybe with a body or a little bit opaque, will give you a better result more predictably and more quickly.
And as we already mentioned, this incisal translucency, if we use the simple technique, how can we achieve it?
Sure. Right. So a lot of times when we're layering, we're trying to add certain characteristics and adding very clear composites. Using the simple technique, or what we call the blank canvas technique, you're going to rely solely on tints. So, for example, many manufacturers make a gray or a violet tint, and you can use it in certain ratios and pretend, if you will, add some incisal effect. So it looks like some translucency, and really all you're adding is just a covering. The advantage to that is that by adding the small amount of flowable tint, you are just painting over an area that has already been covered from fracture. Because if you're trying to add clear over a fracture, 100% of the time you're going to say fracture.
Yes.
So this is a nice way to do that.
And what do you consider the biggest take-home message of your lecture?
The biggest take-home message is don't be afraid to try. There's a saying that the master has failed more times than the apprentice has even tried. And this is absolutely true in dentistry. A lot of times we show our best work, right? But do you learn from always your successes? Sometimes it's just luck. But with your failures, there's always some message.
Yes.
But the thing is, there's ways to fix it. So there's many good resources. So my take-home message would be practice, try to implement the principles that were discussed, and really work to develop your eye, which is why we call the course Power Looking, which is really about strengthening your ability to evaluate things. Because you do not know what you do not know. is the saying, right? And if you didn't know that you didn't know it, then you were going to have problems.
Doctor, thank you very
No,
much.
it was my pleasure.
It was an honor to have you.
No, thank you so much for having me.
I was talking to Dr. Arthur Volker from the United States at the DentalWorld conference.